introduces our speaker, Alex Berry.
Good morning. It's, I guess, always the standard when you begin these kind of. Come on, don't shout. No, it's no. When you begin these kind of presentations to sort of introduce yourself, and what you're doing, I think, is establishing the argument of authority, right? Oh, I have so much background, and this is where I've studied, and blah blah. So it makes it sound important. What you're going to say has some relevance. That's the standard. But I think more important, particularly for a talk like this, where we're going to start with an issue of spirituality in Chinese medicine. More important is to understand something about the nature of the lecturer than some background. And we'll get to my background in a minute. But I think it's important with all presentations, particularly in an art like Chinese medicine, to realize that the teacher can never tell you something that's true. They can only tell you their own delusions about how things are. And then you have to see how that harmonizes with your worldview and what might be useful about their delusional view. This was particularly driven home to me some years ago. I was in the Jade Buddha Temple in Shanghai, maybe 25 years ago or so, and I was looking. They have, back in the Cultural Revolution, they were destroying a lot of the temples, but Zhou Enlai, the premier of China at that time, had some troops at his disposal and managed to dispatch them to what he thought were very culturally relevant sites to sort of protect them from the Red Guard. So Mao was doing his thing, struggling with others in the government, releasing the Red Guard, and Zhou Enlai was sort of in the background. Oh, I can protect this and I can protect that. And one of the things he protected was the Jade Buddha Temple in Shanghai. I think, we can wonder his motives, but maybe because he thought it would be a good tourist site later, which in fact it turned out to be. But it had one of the few places that has a complete collection of the Buddha Sutras. And so I was in the sutra room there, and it's, a big wall of old texts, and I'm sort of looking at it and just sort of in wonder at this. It's such an interesting display. And this old monk came in, and he was kind of surprised because to see a foreigner in there wasn't so common 25 years ago or so. And so he said something to me which I didn't understand. And I had a Chinese friend around. I got him to see if he could get what he was saying, and he didn't get it either. Turns out he was speaking some very minor dialect. He had been in the monastery since childhood, never learned to speak Mandarin, the kind of common dialect. And so we had to get another monk in there who could speak that dialect to so we were going through these stages of translation. It turns out what he was saying to me as he pointed to all this stuff was, it's all lies. And so then, of course, this had to engender a discussion. And the point came that there was no true spiritual teaching. In fact, what spiritual teachings were ways to balance people's misapprehension that was causing them some kind of discomfort, some kind of suffering, was preventing them from really fully realizing themselves. And so all the teachings were ways, and I thought this is exactly what Chinese medicine is, right? We don't say there is a correct treatment. The correct treatment is the one that balances the person's condition. Some people have a more cold yin condition, therefore they need yang tonification. It's going to be a totally different treatment than the person with heat, right? We're bound, and it's the same way with spiritual teaching in that Buddhist tradition. You're saying something not because it's true, but because it balances the person's difficulty in some way. So this then there is the Buddha saying that's, I think, kind of relevant to that these teachings are therefore more true than facts. They're not basic facts. They're something useful and so as I go to present, I have my things that make my life and my perspective, and those things are more true than facts for me, but they may or may not be for you. You have to, because I'm basically a clinician. So you have to see how are these things relevant to the way you like to interact with your patients. How are they useful to you in then balancing your patient's condition to help them actualize themselves. So as I say, as we begin this, it's important to get a sense of who that teacher is. And I think you can learn that a lot from just observing them. I taught a seminar, and it's a story that it's, once in a while you have those life events that are great because they're kind of a feeling or a story that sticks with you. And I just had the good fortune a couple of years ago, I was teaching in Denmark at the first Scandinavian acupuncture congress. And they did something unusual, whereas most of these larger congress have a time in the morning where all the speakers come and present for 45 minutes or an hour about their topic, and then later they'll do a much longer presentation. That's sort of the standard. But at this congress they said, no, we're not doing that. We want all the speakers to come at once. Oh, and by the way, when we have those morning things where we have to speak for an hour, I always avoid them because I go and do my hour and I don't come and hear anybody before me. I don't stay and hear anybody after me, because if I do that, I end up presenting my reaction to what they said. Because I'm very much a stream of consciousness lecturer. What's on my mind really biases my presentation. So if I come and I listen to an hour of somebody's talk before me, I start, but this congress, no, all the speakers have to come. They sat us all in the front row, and each person only got 10 minutes to speak about their topic. So what can you do in 10 minutes? Well, what each speaker did was get up and say what they're going to talk about later. I mean, how boring can that be? So each speaker standing up 10 minutes, I'm going to talk about this and this aspect later. Sit down. Well, I was sort of in the middle of the group. So, 3 or 4 speakers went before me. And what I was, I was saying, here he goes. He's telling what he's going to talk about. What should I do? What should I do for 10 minutes? Because I don't want to do that same thing. So I started to notice that some people, would stand still behind the lectern, and other people would step out in front of the lectern. Some people waved their arms. So I thought, I should point this out to the group. So I get up and I said, well, I'm not going to tell you what I'm going to talk about later. Instead, I'm going to invite you to try to diagnose me. Everybody studied visual diagnosis. You can see how I am. I'm up here waving my arms. I can't stand behind anything. I mean, they gave me a mic this morning. I'm like, you have to hold that hand still. I mean, it's impossible for me. You get a sense of my nature. So I said, I invite you to do the same thing now as the rest of the speakers go. Try to diagnose them. See who they are. Don't listen to what they say. After all, they're all just going to tell you what they're going to talk about later. So instead, you should be doing diagnose. See who this person really is. And so then the rest of the people had to get up and do their 10 minutes. And of course, they're all very experienced speakers, lecture a lot. But they'd get up and you could see somehow they were apprehensive. And in fact, one of the speakers, he was like, after Alex said that, I don't know where to stand now. Right? I disrupted their sort of internal state somehow they became very self-conscious. Right? But what did I invite the audience to do? Read who that person is. So it's a kind of a very important question. What internal state got disrupted in those speakers? Very relevant to our talk of spirituality. The Chinese actually have an important name for this internal state. It's called Ding Li. Li, this word Li is power or force. The Ding Li is the central force in the body that allows for stability. They say it's the force when all the internal dialogue of your mind has ceased. That's an interesting statement. When you cease your internal dialogue, then you have the most Ding Li, the most central force of the body. Of course, if we want to be clinical about this, it actually is the Chong Mai. It's filled with blood. It's connecting the kidney to the heart. It goes through the spleen. The spleen is very set. And so, in fact, in some ways, we say that the spleen regulates the Ding Li because it's the central force. We often talk about, are you grounded? You see this happen. Heat goes up the Ding Li when you get really nervous. And so your voice starts to get higher, right? You start to sweat on the palms and so, that's actually pericardium related. When you because the heart produces sweat, right? And as the heart produces sweat, when it's conducted out, like to the palms especially, it's coming out to the pericardium meridian. So people with sweaty palms, you usually have to regulate the pericardium meridian. It's the connection of the heart physically outward. So that's a sign that Ding Li has heat is going up because I'm nervous. So we can tell you when we're going to treat the Chong Mai to help anxiety, because it's going to bring that back down, right? So to understand this Ding Li a little bit better, there's a famous teaching story about it. It comes from our Qigong tradition. There was the Tai Chi master, and when you practice Tai Chi, there's a form called push hands, right, where you're actually trying to unbalance a partner. And there was a famous Tai Chi teacher, and he had a long-term student, and at some point during the push hands practice, the student began to be able to push this teacher. And he could even unbalance him all the time. And the student became quite proud of his elevated ability now. And so he said to the teacher, I think I now have mastered this skill. I think I don't need to study with you anymore. And the teacher just sort of laughed and said, oh, is that so? Well, let's test that theory. Let's go for a walk. And they go walking in the woods, and they walk for a long time, and the student is like, what are we doing? And finally they come to the edge of a cliff. And the teacher said, okay, now let's do push hands right here on the edge of the cliff. And suddenly the student was unable to maintain his balance. He was so afraid, so distracted by the edge of the cliff. And the teacher said, oh, see, your ability is at a very low level. In the classroom, stability, no problem. Now, in this kind of environment, your Ding Li, that central axis of the body, connecting, we often talk about in our clinical diagnosis, disconnection between heart and kidney. How does that disconnect happen? It's this disconnect of the Ding Li, that central force, is the issue. So this is very relevant to our discussion of what is spirituality. One thing we want to do in a patient is always reestablish their Ding Li, their central force that connects heart and kidney. We'll see later as we talk about Yangsheng, nurturing life. And two of the issues we're going to talk about are breast disorders, prostate. They're all relative to this. It's really that central pathway that's disrupted. I think this is why you often see in modern society problems in those areas, because our modern society doesn't cultivate Ding Li very well, because people are so unclear about their place, about their direction, about their sort. It wasn't that long ago that even here in the West we had a more traditional society in that roles were well defined. When you feel comfortable in your role, the Ding Li is cultivated. When you feel insecure about your choices, the Ding Li is disrupted. And this is what modern society, we see it struggle with our patients a lot. Right? They come in and, now we go a little bit to some background, but my clinical practice for a long time was extensively pediatrics. And I see this all the time in pediatric practice, that people don't know what to do with their kids. They don't know what to do with parenting and family life and all that. They're trying to figure it out. I had an old Korean mentor. That was my beginning in Chinese medicine. And when he came to the States with me and started to see patients here, he was always like, this is so strange you Americans have no grandparents. I'm like, what do you mean we have no grandparents? He said, well, people are coming and asking me questions they would never ask me in Korea, like, what should I eat when I'm pregnant? Don't come and ask me, the practitioner. Ask your grandmother. She knows that. And she knows to cook chicken or fish soup with kombu and sanchi in it once you give birth, and to give you that for at least 3 to 5 days. And she knows those things. That's her job. You don't need to come to a practitioner for, well, you sure do here. And then, what about all these other issues? As I was driving in, I saw a billboard. I live up in Asheville now, and I was driving down, and I saw a billboard. Breastfeeding is best for both the mother and child. They had to put that on a billboard? Like, I mean, what kind of culture is it that wonders, or would be, that needs to be informed that that's true? Our culture. And so this is the situation that we're encountering in the clinic. So people's Ding Li is really disrupted. There's that debate going on now about how long to breastfeed. You've been following that. I mean, some people 4 years, some people even saying 6 years. Oh my goodness. You know, you want to talk about a blood deficient mother. I want to see one who's been breastfeeding for 6 years. You know, and then she's supposed to have enough resources to take care and attention to the child. That's going to be very unusual, isn't it? So if we're in a culture, an environment that creates this kind of questioning, I mean, how many of your patients come in struggling with what to eat for themselves? Because no matter what they choose, guaranteed there's someone who says that's the wrong choice. Should I eat a raw foods diet? Should I eat more whole grains? Should I eat just protein? So many. Ask your grandparents what they should eat. Normal food, right? That they would just shrug it. It wasn't, I know my grandmother, I remember as a child, I mean, I think my grandmother was a Taoist, even though she was an Italian woman who came from Italy, you know, because if you look at Taoist recommendations for living, which we're going to get to in our lecture, you know, my grandmother, she was always dressed in what I thought as a child was the same dress. And I said to her, Grandma, why do you always wear the same dress? She says, what do you mean the same dress? She actually had just a bunch of dresses of the same style. She goes, because I like that dress. It wasn't like a big choice. But as you have to make decisions, remember, part of bringing your personality out, again, something so important in our pediatrics practice, bringing your personality out requires the kidney yang to move up through the central channel. On the way, it activates the gallbladder. And the gallbladder helps to conduct your personality outward. We often see this. People with phlegm obstructing the gallbladder and the diamine can't bring their personality out. How often do we see it with children? Kids are by nature little snot balls, right? They come to your practice, they're wiping their nose on the carpet. You think you have snails. What is that, right? Right? So they have all that phlegm, and yet, by nature, they haven't grown into their yin and blood yet. You don't have your full complement of yin and blood till you reach full height. This is why a woman, even if she, in theory, is fertile, she's gone through puberty, she shouldn't yet conceive a child till she reached full height. Then she'll have the maximum amount of blood and yin to give to the child. So yes, a girl 13, a girl these days 10 could potentially become pregnant. Is it a good idea? Absolutely not, because she doesn't have the resources yet to really nurture the child. But once she's reached full height, she has her full complement of blood and yin. So, by the way, we're going to talk about cycles of life in a minute, but just to looking out at the audience, I know this will strike a chord with some. You're at your best from the time you reach full height, which for most of us is late teens. Some people even, it's 20, 21 before they've reached their full height. But from that until either age 35 or 40, that's the best time of your life. That's when you have the optimum amount of blood and yin. For you women, it's 35 you go over the hill. For us men, it's not till 40. We got a little reprieve. But don't worry, I went over the hill a long time ago. You know, I'm almost in old age now, which, remember, women are developing in cycles of 7 years, men in cycles of 8. The reason for that is that women are primarily yin. Therefore, their yang is what's driving the aging process because they have relatively less of it. That's why they go faster. So if you wonder why women who live longer cycle faster through the different stages of life, I mean, you only have to go to a middle school to see this, right? You look at the 14-year-old girls, and they're all developed and putting on makeup, and you know, and then the boys at that same age are like looking at the girls and throwing like spitballs at them because they're like totally underdeveloped in comparison because the boys are primarily young. Therefore, it's their yin that drives the aging process. And so they age slower. They develop in cycles of 8. So a 16-year-old boy and a 14-year-old girl are on the same level. By that time, you're 2 years behind already if you're a boy. So therefore, we men don't go over the hill till age 40, whereas it's 5 times your cycle. So in the case of women, 5 times 7 is 35. You've reached your peak. In the case of men, it's 5 times 8. Now, if that's true, if you go over the hill at 35, what does that say to us in our clinical setting when all these women come in 35 and older and want to have their first child at that time? They're already over the hill in terms of full complement of blood and yin. Therefore, you better treat them. See, this is the second aspect of my delusional nature. I don't want to tell anybody what to do. That's my nature as a practitioner. Because it comes from the fact I don't like to be told what to do. Given that, I don't want to make judgments. This may not harmonize with you. You may be a clinician who loves to tell people what to do. I had this experience some years ago, geez, more than 30, about 30 years ago now. I had a clinic in Boston back then, and my partner was a Swiss fellow. And he was very Swiss in nature, in that he was the kind of guy that put up lists around the clinic of how you should behave. You should do this at this place as far as processing. Back then, we reused the needles. You had to autoclave them and stuff, And so there was the list on how to run the autoclave and how to process the needles. There was the list on how to do the filing. There was, that was just what made him comfortable, right? That was his nature. And I'm Mr. Anti-list, like lists drive me crazy. But we were good friends anyway and worked well together, except when we had to take over each other's patients. Because he'd be gone, I'd see his patients, or I'd go somewhere, he'd see my patients. That's always one of the nice things of a group practice. But what would happen? I'd go away. Well, first, he'd go away, I'd see his patients. He'd come back, his patients would tell him, "Oh, Alex, nice guy, didn't do anything." I'd go away, he'd see my patients, I'd come back. My patients would say to me, "How could you leave me with that guy? He was so pushy. Oh, he was terrible." This is the reality of clinical practice, isn't it? So my way is not to... So if a woman comes to me and she's 40 and hasn't had a kid and wants to have one, what can I do to support her? It's not for me to judge. But I can know that she is already past the age where the full complement of blood and yin is present, and I better support that in some way, so that that baby gets the maximum benefit in its development. Right? I can understand the process. So I always see that as my role, to help people understand how their choices are influenced by the outer circumstance, and what can we do about it? Like I say, our society has a lot of argumentation about the right choice. Should you vaccinate your kids or not? Well, the truth comes in. It depends on your viewpoint. If you take the view from general public health, even if every possible bad thing they say about vaccinations is true, like causes autoimmune disorders, weakens the immune system, maybe is the cause of autism, maybe all those things are true. Doesn't matter. If you're looking from general public health, vaccinate everybody. Because the negative consequences in terms of autism stuff are still less than the economic and social consequences of big epidemics of these childhood disorders. But if we look from the individual perspective, it's totally different, especially if you look from the individual perspective in a generally vaccinated population. You shouldn't vaccinate your kids. No reason to. It's crazy to. This is why if you do an anonymous survey of pediatricians, many of them do not vaccinate their kids. I dare you to find a pediatrician saying that in public. It's really rare. Because if you're not vaccinating your kids, you want everybody else vaccinated. It's just, right? That's the truth. So the reality comes from perspective. So now what is the individual person supposed to do? They have to choose. Which side of the argument do I want to fall on? And if the person says, I feel like I have to vaccinate. I know I'm going to put my kid in that private school that just won't let him in without vaccination. I just can't bear the amount of pressure I'm getting from my parents or from the grandparents, or maybe I just couldn't bear if in fact they did get something, I would feel just so responsible. I just have to vaccinate. Should I talk her out of it? I don't think so. That's my nature. Maybe it's your nature to talk her out of it, but not mine. My nature is to say, Well, what can we do then to try to protect your child from the negative consequences of vaccination? Some of these things are possible, like they may cause autoimmune disorders. After all, isn't a vaccination introducing xie qi, evil qi from the outside in an unnatural way? You study in school that these external evils penetrate the body in some kind of sequential process, allowing the body to make a reaction to it. So when that evil qi comes in, it's hitting the wei qi, whether you're thinking from a Shanghan type of perspective, it's okay, it's at the Tai Yang and then penetrating to the Xiao Yang or Yang Ming, like that. Or whether you're thinking from a more heat perspective and saying it's going from a wei level to a yin level, penetrating in finally to the blood. Well, the body mounts a defense each stage. And when that xie qi hits the wei level, big fever should happen, showing that your zheng qi, your normal qi, is fighting with the wei qi. But what happens in the vaccination? Right to the blood level. Right down through the... So the body doesn't get to make a normal reaction. Therefore, you get what's called in Chinese medicine hidden evils. It's kind of a latent, lingering pathogen phenomena, which generally then causes phlegm and heat. Well, if it causes phlegm, it's so understandable how it could be underlying autism. Because autism is principally phlegm misting the mind, causing withdrawal of the shen. And you see when we give herbal treatment to kids with autism, the chief herb is Shichangpu, and the second chief herb is a Hoxian. Quite surprising in a way, because we normally think of Hoxian as more regulating phlegm accumulation in the middle somehow, in the digestive system. But after all, kids are all abdomen, And so a lot of that obstruction. So when we want to open the child's mind again, we clear the mind with the Shichangpu, we open the middle of the body by using Hoxian. Well, Hoxian, after all, is patchouli, right? There was a reason, back when I was in college, all of us smelled like patchouli, because I think we had a lot of phlegm in our mind back then, right? And so, so if indeed this hidden evil is generating phlegm and heat, it's not surprising that it could underpin autism, particularly in those kids who had the tendency then to go in that. Why is it so difficult, we might ask, to track, is this a causative agent? Do vaccinations indeed cause autism? Because when you have a circumstance that a triggering cause only affects those people already vulnerable or susceptible, it's harder to see that than when that triggering cause is so overpowering that it affects everybody who gets exposed to it. And this is, I think, what modern research is struggling with. The only kids who get autism from vaccination are those who already have a propensity moving in that direction. And then this is the triggering. After all, we say that in Chinese medicine, right? You need both triggering cause. That's what you study when you talk about the three causes: external, internal, miscellaneous. Those those are just triggering causes. But then you need the right environment, the sort of secondary circumstances. And in Chinese theory, they always talk about that metaphor. It's all metaphor anyway, so they talk about the growth of plants. Yes, you need the seed, which is the exact cause for the plant. So when you plant a certain kind of seed, you get that kind of plant. But that can only come to fruition when you have the right environment, the proper ground, the water, the sunlight, and all of that. Well, that's the way diseases that's the way the body functions. And so in that kid who has the right environment, then you put this seed of the triggering cause of the vaccine, it would be perfectly understandable that these kids can be pushed towards their autistic nature by vaccination. And similarly, if we say vaccinations produce autoimmune disorders, that's the heat side instead of the phlegm side. Because all autoimmune disorders, no matter what its manifestation, always has some element of heat. So important clinically because we see a lot of autoimmune disorders that may not have the obvious heat in the presentation. A good example might be immune-mediated fertility problems. So often we encounter a woman who either can't get pregnant, maybe has been thoroughly worked up by the Western guys, and they finally say, we think you have an antibody to your husband's sperm. Interestingly, that antibody may not be effective against other people's sperm, other men's sperm. I usually then start to discuss with her, does she find the mailman attractive, or something like that. She could probably, but you get the why does she have an antibody to the husband's sperm? Because she's encountered that sperm multiple times. It's given the body a chance to develop that antibody. But where another immune-mediated phenomenon is where she has an antibody against the developing fetus. And this is the woman who sort of miscarries regularly in the 4th or 5th week of pregnancy, over and over again. If you would see her just from your Chinese medical analysis, you might think, oh, let's tonify kidney. Oh, because the kidney controls reproduction. And should I tonify kidney yin or yang? Well, kind of depends on, some of her appearance. Or do we need to tonify liver to build up the lining of the uterus? Well, I can see a little blood deficiency in her, But you'll find your treatment will work, not just by giving blood tonics, kidney yin. You give heat clearing. It shuts down that autoimmune response. And it's because the heat is hidden. This is why we don't see it obviously in the pulse and tongue. So we can't forget this sort of hidden evils aspect. So this is characteristic in autoimmune disorders. I don't care what it is, rheumatoid arthritis or whatever, and you're diagnosed as cold B syndrome. I'm still clearing heat. Because that's what's going to shut down that autoimmune response. If we look from the biomedical side, it's what's going to clear that hidden, lingering pathogen that's there from the Chinese medicine side. So after all, vaccinations could be triggering that kind of heat, and that's going to have its consequences, autoimmune disorders, skin rashes, or whatever it is. So what I say to the parent who says, oh, I'm going to have to vaccinate my kid, I can support you with that. I'm going to give your child an herb formula called Shiwei Baidusan, 10-flavor overcome toxin powder, which prevents this hidden heat, this hidden pathogen from lingering in the body. So that's, but what if instead the parent says, I'm not going to vaccinate? Well, then I say, okay, that's a legitimate choice. Let's make sure we, of course I have to translate for the Western audience, so I say, let's strengthen your child's immune system to make them so that if they do encounter, like right now there's a big outbreak of whooping cough. A lot of kids are getting whooping cough right now. I forget the count in Asheville now, but that was just in the paper, they had the count on how many, it's sort of up in the 30s or 40s of kids they've tracked with whooping cough. Right? So I want to protect your kid if by chance they encounter that. Even if they get it, it's only a few kids who get whooping cough where the phlegm penetrates the lungs so much that they're getting that stringy phlegm and they get that spasmodic cough where they're coughing more than the interval between coughing and then they start to have trouble oxygenating, or maybe it damages the lung qi and yin and then they have really the 100 days cough phenomena where they kind of get a little better as far as the fever going down and yet they keep coughing for 3 months. Only a few kids get that reaction. Other kids get whooping cough, get through it. The parents sometimes don't even realize it was whooping cough, right? So how could we help put our patients into that category of kids? If they do get it, it's not going to be a big deal. I better strengthen their Wei Qi. Give them more resistance to these external evils. So how do I do that in kids, by the way? Don't just give them Yu Ping Feng San, jade windscreen formula. You need to also balance their internal condition more because, well, let's as I said, I always want to make this kind of presentation as clinical as possible. So let's digress into that for just a moment. And again, this is not just informational as far as things to do in the clinic. It gives you some sense of who I am as a practitioner or how I like to approach the patient. So the first thing we're going to do as we encounter somebody with some kind of external evil thing, you always want to treat the site where the pathogen, where the evil qi. So we could say here, local site. I am Mr. Local. One of my friends, another famous lecturer, is out there. He always says, "Oh, if Alex is coming to speak, you're going to see Mr. Local," as opposed to you told me you had Richard here, Richard Tan here. Richard and I are friends, and I know he's Mr. Distal, right? When he does orthopedic treatment, pain control, or whatever, he's always about treating some distance from the site of the problem. Using some kind of body polarity, like a diagonal polarity or something like that. This is so opposite to my approach. Again, it's not my approach. It's what the sort of lineage of Chinese medicine that I was taught was always about the body shows you symptoms in a particular area for a reason. They are meaningful, and therefore paying attention to the symptomatic area and treating. So if you're treating orthopedics, my perspective is I always want to find the site of the orthopedic lesion. I want to think about the construction of the anatomy there, and we're doing acupuncture as one of our modalities. It's fabulous because it allows us to touch inner structures so well. So I want to reach that spot with my needle, especially in poorly vascularized structures like the interior of joints. You come to me and you have a tear in the meniscus, I want to arrange your knee in some way that I can reach that needle in there and get into that avascular part of the joint. Now, some people get all frantic. They say, "Oh my God, isn't there a fear of inducing an infection into the structure?" No. If you have reasonably clean technique, no problem. And then what happens? When you stimulate that local site, that so-called avascular structure suddenly starts to repair. Then what's the Western guy say? The orthopods say, "Oh, I guess the tear wasn't in the avascular part." No, just because he hasn't recognized there is a mechanism by which we can create change in those structures. They're not dead. They do change. And we have the capacity to move qi and blood in that area if we can reach that local site. And the same thing is true when we're talking about external evils. We want to treat that local site, reach that place. For example, we often see so-called focalized infections in the sinuses, in the throat, at the base of the tooth. I want to reach that site with my treatment. I'm big about put the needle in from the outside, go through the cheek, into the gum. If you see that shadowing at the base of the tooth on the dental x-ray, and the dentist is saying, "Yeah, there's probably a little abscess at the base of the tooth there," it may even be silent to the patient. It hasn't yet become inflamed. I'm putting a needle in that thing. You're going to disperse that evil. So in that sense, I'm Mr. Local always. I want to touch the site where the symptoms are. That's the way the person is revealing to me their situation. So if we see, now I must say there are times I back away from this. I was taught by my teacher, and I've seen it demonstrated many times in China, where when people have evils in their throat, you needle the tonsils directly. I just hate to do that clinically. Again, as part of my bias, I want my patients to enjoy the treatment and feel it relatively comfortable. And I find people don't like it so much when I stick needles back and touch the tonsils. The technique is actually to take 3 needles and wrap a little thread to hold them together. And then you can even put some herb powder on the tops on the needle, and then you reach back and touch the tonsil. And the herb powder you use might be something like a powder of botulinum gun. Botulinum gun is particularly a good choice because it kills strep. So if in fact there is strep in the throat, you take botulinum gun powder, you put it on top of those 3 needles, and you reach in there. I've actually even had a teacher, an old Chinese fellow, who, because he often didn't have a needle long enough to do this, would take a pencil, stick normal length needles through the eraser of the pencil, and therefore have created his instrument now. I mean, again, the hygiene of it is suspect, but that's a... So what do we do? If we can't reach the actual local site, well, there's another important aspect, and that is lingering pathogens. Hidden pathogens typically are in the Shaoyang, and therefore they affect the lymph. And the lymph swell because phlegm and damp hold the lingering evil in the body. And so you'll see typically patients, and especially children who have hidden or lingering pathogens, do have lymphatic swelling, often asymptomatic. So much to the point that a lot of pediatricians say, kids often have swollen hard lymph nodes that don't mean anything. Of course they mean something, even if they're not obviously producing symptoms at that moment. And so we always want to treat the lymph as part of releasing that intermediary level to release it. How do you do that? Do you want to use herbs that have an effect on draining lymph? Certainly that's possible. Do you want to treat the lymph node directly? Maybe you do lymphatic drainage type of massage with your tuina, like a kind of a springing method. Or do you want to just stick a needle in that dang thing? You put a needle in that swollen lymph node, and particularly if you connect that needle with electric stim, you're going to get significant lymphatic drainage from that, and that's really going to help clear these hidden pathogens from the body. So I use that a lot, and I recommend a low frequency of your electric stim, around 10 hertz, because that's what's going to give you the most local movement, and that's what you want to do. It's better, in my experience, than any sort of lymphatic drainage massage. And this is a safe thing. It's not particularly painful or anything like that. So if you're not doing it, you should start doing that. You find swollen lymph nodes anywhere in the body, stick a needle in it, run your electric stim on there, and promote drainage. Now, you may argue that if the lymphatic swelling is of unknown origin, there's no preceding infection, no history of febrile disorder, and we don't know why it's there, okay, maybe we need to explore that issue and see why the person would have lymphatic swelling. Of course, the background fear is, could this be some sort of lymphoma or something? But this is not what we typically encounter clinically. We encounter people with swollen lymph nodes that are residual to some previous febrile disorder. In that case, you can feel very comfortable with this technique. And then we can actually do something. How about 2 points, gallbladder 37 and 40? This is representative of a needling technique of using the low and yuan points on the same meridian. This is always helpful for clearing lingering hidden pathogens out of that meridian. In this case, we chose the gallbladder meridian because gallbladder is the dominant force in the Xiaoyang. If you want to use Sanjiao, the triple warmer meridian 2 with triple warmer 5 and 4, again the low point and the yuan point, you could do that. And you could use this on another meridian if you thought, oh, that meridian is particularly relevant for this patient. This is where the lingering evils are. You could use another meridian. But most of the time we find that the gallbladder is particularly good. Again, because phlegm is such an aspect of holding evils in the body, and bile cuts phlegm. So therefore, if we activate the gallbladder meridian, we then drive phlegm out of the body very much, and this helps free this is why we typically process herbs with bile when we want them to be more phlegm clear. For example, Dananxing. Tiannanxing is a little bit phlegm clearing, but Dananxing is a lot better. Many of you study with your point prescriptions that stomach 40 is the best point for generally clearing substantial phlegm. And of course, then we should ask, why is that true? It's true because stomach 40, as the low point, drives yang qi from the stomach meridian towards the spleen, and therefore forces the spleen to transform phlegm. You would actually make this more effective if you added spleen 3. Now the yang really enters the spleen and would transform phlegm. That's the more standard low point, yuan point on partnered yin-yang meridians, as opposed to what we did up here, which was on the same meridian. But this is why stomach 40 has as a function to transform phlegm. But we make it even more powerful if we then add gallbladder 34. My old mentor saying, oh, combining gallbladder 34 and stomach 40 is like treating it with bile. It's the same as cooking the herb in bile makes it more phlegm clearing. So does activating the gallbladder help to clear the phlegm. So for these reasons, we tend to emphasize gallbladder 37 and 40. It's no surprise that we use a very liver gallbladder herbal formula, Xiao Chai Hu Tang, for this kind of effect too. Now this whole little digression into this discussion started from when I said don't use Yu Ping Feng San, if you remember back. We're videoing today, and for those of you looking on the video, but you could rewind and hear that in fact I didn't just fly off under the discretion. This came because I said don't give kids Yu Ping Feng San if you think you're going to build their Wei Qi. What you give them is Xiao Chai Hu Tang plus Yu Ping Feng San. Much more effective. And in fact, I find this generally true with adults, but essential in kids. You give kids Yu Ping, you get all these little snot-nosed kids coming and getting sick all the time, and you take your standard Chinese medicine theory and say, oh, I should give them jade windscreen because that's going to build their Wei Qi, and they still keep getting sick. Well, just try combining Yu Ping Feng San with Xiao Chai Hu Tang. It's a much different effect, and give it to them for a while, and give it to them in a bigger dose. I'm sorry, I know this isn't a pediatric lecture per se, but a couple of things I just would like to share is a lot of you may be working with kids and you'll then have a case where they're not responding, and then you might want to email me, say, oh, Alex is an expert in peds, maybe he can give me some thought that I hadn't. And typically what happens, you send me the description of the case and I think, oh, you made the right diagnosis, you're giving the right advice, but you aren't giving enough, and you didn't give it long enough. That's the typical mistake made with kids. Pediatric herbalism, I would say the rule is give more herbs. Because herbs cannot be reduced proportionally to body weight. They are multi-agent substances. Each herb has several active principles. Each formula has then several herbs. If you start to reduce your formulas proportional to body weight, you will quickly drop below the therapeutic level of some of the important substances in the formula. So, bigger doses. Heck, after 3 years old, unless the formula contains something, kind of extreme and toxic, give them the adult dose. You'll just start to get much better results in your pediatric cases. Anyway, so Xiao Chai Hu Tang plus Yu Ping Feng San, give it to them for a couple of months. You're going to see, oh, that worked much better. Those kids are getting sick way less. Those recurrent ear infections are way reduced. And then, of course, Xiao Chai Hu Tang because it has Bansha, and because it has a qi tonic these days, usually Dangshen in there, it helps the spleen. And so it's actually helping get the spleen to work better and clearing some food retention in the stomach. One of the big causes of this is actually going a little more towards Yangsheng than spirituality, kind of nourishing life. But one of the big causes of dysfunction in the body is food retention. A health practice is to make sure this is why in Yangsheng, one of the important general practices is always walk 100 steps after eating. That helps prevent. Now, don't go out and count 100 steps. That's exactly wrong. Exactly what not to do. Because overthinking diminishes the spleen. That's why they say, eat with your stomach, not your mind. People always eat with their mind these days when they're trying to be healthy eaters. So they're thinking. And I have so many patients over the years who their way of eating healthy is so distorted. Oh, is this the right food? Is this good for me? Oh, and then they get into some diet trip, their macrobiotic, and oh, this is too yin, and that's too yang, and it's not quite perfect, and or they get into that thing, oh, I'm not going to talk when I eat, and it's like that's the wrong way. The stomach should, when they say eat with the stomach in China, they mean, it should be pleasant, it should taste good, it should be a physicalized experience. Eating is not a mental experience. So we want to eat with but on the other hand, what do we tend to do? We go overboard, and we overeat, and we eat foods just we like, and then we eat out of stress. For example, we typically crave sweets when we're stressed, because sweets have a tendency to kind of weight down the qi temporarily. And we see it, don't we? You take sweets, and you often and then you see it with kids. They temporarily satiate them, and then it erupts again. The heat comes out again. And so you can guarantee the person who says, I come home in the evening and I eat a gallon of Haagen-Dazs, right? That's a common, they are using that sweet taste to dampen down stress. So they're eating out. Well, they end up with food retention in the stomach. When you have food retention in the stomach, if you're a kid, what does it do? It goes up the stomach meridian's internal pathway and then fills up your ear. That's the big cause for recurrent ear infections. Food retention in the stomach, going up the internal pathway of the stomach meridian. So you want to, this is why recurrent ear infections are so culturally determined. If you're in a culture that has low-calorie diet, without much fat, doesn't eat difficult to digest foods like dairy, very low level of recurrent ear infections. Now they might have other problems, but that's not the one they're going to get because they're not getting food retention in the stomach. I mean, I had a clear example of this in my studies in China. I first studied peds in China probably now 27 years ago. It was the first time I took a peds class in China. I was already treating kids in my clinical practice. I went to China, and the practitioner there that I was observing said, "Oh, tell me what you're seeing a lot in your clinic." And I said, "Oh, I see most with kids recurrent ear infections." And he was like, "Oh, I don't see that much. Let's talk about something important. How about torticollis?" And I'm like, torticollis? I mean, you do see it in kids. You know, usually when they have a swollen lymph node and it causes the local muscle to spasm, it pulls the head off to the side. But I said, I'm not seeing that much. I'm seeing recurrent ear infections. He said, again, I don't see that much, you know? In fact, I rarely ever pull out the otoscope to look in kids' ears, was his comment. And I'm like, geez, I look at every kid's ear because it's so standard here. Well, remember, 27 years ago in China, you couldn't buy dairy products without a ration stamp. You couldn't buy cooking oil except with the ration stamp. When I would visit friends at their home, which wasn't all that common because a lot of people didn't want it on their record. You know, there was always, back in those days, a person in each living unit that would write down the comings and goings of everybody else, you know? And they didn't want it on their record. They had a foreigner visit their home. That could stop a promotion at work or something like that, you know? But occasionally you'd get invited to somebody's house. And you'd say, what should I bring? You know, the traditional gift is like, bring oranges or something. They said, no, don't bring the oranges. We can buy oranges. Bring cooking oil. Because I had foreign exchange certificates, I could go buy cooking oil without a ration stamp. Oh, great. Bring a big can of cooking oil. That's what we want, you know? Well, you think you're eating a diet, no cooking, low cooking oil, there's no food retention in the stomach. So then nobody's getting ear infections. But now you go to China. Lots of recurrent ear infections. Equal with here. Because everybody's eating ice cream all the time. Right? We really have a good observation there of the change in a disease pattern as the dietary patterns have changed. You know? So anyway, so this formula is working against food retention in the stomach, but it does tell us that we really need to protect against food retention in the stomach when we want to promote health and longevity in general. In fact, then we can look back to some of the sayings about, you know, there's one traditional saying that says, the first disease is digestive, and the first treatment is to drink boiled water. That's telling us that digestive upset is at the root of so many dysfunctions. And then there's this discussion about why this is true, why in human beings is the first disorder digestive. And the saying is that it's because we stood upright. So we took the stomach away from the earth. Where the animal has very strong stomach chi and rarely gets food retention. Which is true, right? Very rare for animals to get food retention in their stomach. They are horizontal with the stomach near the earth. So there's this sort of, again, the metaphor comes into play. The earth, representative of earth chi, close to the stomach. Now the stomach is filled with chi. The human being stands up. The spleen has to work hard now, lifting the central chi up to the head. So if the pure yang rises to the mind, it gives you clear thinking. I mean, that's relative. That's very relevant to our spirituality issue here, is that if that spleen is weak, you don't get the pure yang in your mind. You can't think clearly. Again, think back to autism and phlegm obstructing the mind. The spleen isn't able. Think about bedwetting. We often say bedwetting is a sleep disorder. Those kids whose, in fact, their bedwetting is related to the fact they sleep so deeply they can't wake themselves up. And you always see those kids because the pediatrician tells you, oh, try this whenever you go to bed, wake your kid up, because the kid go to bed at 8, parents don't go to bed till late, you know. So wake your kid up, put them in front of the toilet or sit them on the toilet, let them urinate, then they go back to bed. That'll cure their bedwetting, because they'll learn to wake up when they have to go. And then the parent tells you, I tried that. I had this little, because you're just boys, right, in bedwetting. I had my son standing in front of the toilet trying to get him to go, and he was still sleeping like this, right? I couldn't, no matter what, he couldn't, right? I couldn't wake him up enough to go. That diagnosis, oh, that's spleen not raising the perion to the head. You've got a tonified spleen in those kids. It lifts the central chi, no wonder it holds the urine in, and it makes it possible to wake up clearly when you need to. Now, I will say something here. That is that's not the most common kind. Even though modern biomedicine likes to talk about the issues of sleep disorder in bedwetting, it's not the most common kind of bedwetting you're going to see. Neither is the most common type. You see the kind in the Chinese books where they blame it on the kidney. The most common kind of bedwetting you encounter clinically has to do with liver stagnation. This is why the more stressed out the family is around the bedwetting problem, the harder it is to treat, because that reinforces the liver stagnation. And so when you get one of those parents who come in, like the mom comes in and says, but what's going to happen when he gets married with this? And you go, but like, he's 5, he's 6. You're worried about when he gets married, you know? Already you can see, this is going to be, so it's all about reassuring the parent first. Don't worry. I forget what the thing is, but 98% or more, it's a very high percent. Kids will outgrow bedwetting without any treatment or anything on their own. So I said, there's no reason to worry about when he gets married and has the honeymoon. He won't wet the bed, you know, it's unlikely. He's not going to be sleeping anyway during that time. Right? So release that liver qi stagnation to treat bedwetting is almost always the right approach. Of course, you could give Sang Piao Xiao Tang, an astringent formula for that, you know, the praying mantis egg formula. But add to that a lot of liver qi regulators. Maybe a formula like Igan San, you know, that regulate the liver power. Something like that would typically work well. Because that's the situation you're usually encountering. Anyway, this is all pointing to the fact that Shao Chai Tang not only is helping us with clearing evils, with building wei qi, but also clearing the food retention in the stomach, which is a big factor in a lot of this penetrating, lingering, hidden evils the body has. You know, the third issue is the issue of when evils enter the body, they need a way to get back out. Very often, we treat in a modern way, like with antibiotics, that will suppress the evil, but not allow it to leave the body. This is why we so often see lingering or hidden pathogens, hidden evils, in people who have used antibiotic therapy. It's like in herbalism. Now, I don't know the group, so I don't know how many of you are just doing acupuncture, how many are using herbs or whatever. But you may be aware, when you use herbal therapy for, say, a heat evil, you just don't do that only. You just don't give, oh, here's an herb that clears heat and toxin, like I mentioned Bonlin Gun a minute ago for strep. That would be incomplete, right? You also have to give spicy cool or spicy warm herbs that open the surface to allow the evil to go back out. Or you give downward discharging herbs to allow the evil to go out through the stool. If you just were to give heat clearers, it suppresses the heat and the evil stays in the body. So I never just give Banlan Gun, Chuan Xun Lian, Pugong Yin, these kind of herbs without adding to my formula things that allow a mechanism for outward movement. But if you just give antibiotics, that's what you just did. You just gave something to suppress the evil without having a pathway for its discharge from the body. So we need to make it go back out. Now we can use points, you know, triple warmer 5, large intestine 4, wind points, all the points that have wind in their name, help the body clear out. At the very least, we can make sure that the bowel movements are moving regularly. I often recommend a glycerin suppository in kids. You stick that glycerin suppository and it's coming right back out, and so is the stool. That's the same as giving a downward discharging herb. You've promoted that elimination from the yang ming. You allowed the evil to go out. So this tells us, if you want to stay healthy, again, sort of with our issue of yang shen is part of what we're talking about this weekend, regulated bowel movements where you go, where you don't have any obstruction there, maintains health. So our third step is to make sure we provide a pathway for discharge. When I see a patient on antibiotics, I immediately give him surface-releasing treatment. That makes the antibiotics work more completely. So they're taking the antibiotics for whatever they got, and they've already started the course of treatment. You say, well, I don't want you to stop. Go ahead and take them for the 10 days or whatever to make sure you don't get a resistant strain. I'm adding to that antibiotic treatment, surface releasing. Whether it's through these points, whether it's through spicy herbs, I want to open the surface and help the evil go out. It makes the antibiotics work much more completely. So that's a pathway for discharge. Now, number 4, there are a couple of points that are special for releasing hidden pathogens. The two that I'd like to emphasize are bladder 43 and bile out. Bladder 43 is for releasing lingering or hidden evils that are in the gao huang. The gao huang is the empty spaces and connective tissues and all of that in the chest area, outside of the lungs and heart. And this is a place where evils tend to hide. It is so important because human beings typically get lingering evils in the gao huang, and therefore it diminishes our lifespan. Many longevity treatments, again, this is going over to our subject of yang shen. If you want to nourish life with acupuncture, many treatments encourage using bladder 43. And at first glance, why that point? Why not some other? Okay, are they strengthening the lungs or the pericardium or the heart? What are they doing? Well, the reason is they're clearing away hidden pathogens. So it's not unusual for a very common simple longevity treatment is bladder 43 plus stomach 36. In fact, you will often see in classical texts these 2 points treated regularly, so-called consolidate the effect of another treatment. You've done something, you've treated the person, they're better, and now you just want to make sure they stay better. You can treat these 2 points for a while. Even better, treat them with moxa. Very standard classical recommendation. And the reason is, this is helping clear from that, the huang in Chinese medicine anatomy is all the connective tissue, and like you have the huang of the abdomen, it's the omentum, it's what glues all the organs in their place. Those are places where evils linger. The gao huang is in the chest. So we're clearing that. Classically they say when you stimulate that point, the shoulder twitches. Modern physiologists have the mistaken notion that the reason the shoulder twitches is that you're stimulating the motor point of like the infraspinatus muscle. But the real reason that the shoulder twitches is because that's the hidden evil leaving the body. That's the classical view of what that twitch is. And then finally, the last thing in this progression of things we're listing here for I hate that that's on the bill. Right, it's so messy. Tells you I have a little liver problem. People with like really lots of qi in the liver, well, they write everything very neatly and organized and in line and stuff, And if your liver qi is a little scattered, you write messy like this. That's why kids who have learning disorders relative to math, it's typically a liver problem, and you actually want to increase liver yang, something that we often don't think of doing because we're always worried about liver heat. I tell you, you get a kid who can't do math well and they can't put numbers in order and in columns and this and that, you burn moxa on liver 1. Warm up the gallbladder meridian, try moxa on gallbladder 34. Suddenly, they start to become better at that. Reading problems, that's more spleen. Like dyslexia or something, usually requires tonifying the spleen. But math problems is liver. And I always think, oh, I must have a little bit. But of course, it probably prevents me from getting so angry. So, okay, I'll live with a messy writing on my presentation. Yeah. Anyway, the final step in this is we want to treat any underlying issue that might make it possible for that evil to hide in the body. The most common one is qi deficiency. If there's qi deficiency, you don't have the force to throw out evils. Make sure that you build up the qi. Well, so many ways to cultivate qi. Of course, you can talk about lifestyle if our discussion is Yangshan. How does the person, and they need enough rest. They need to do things that are fun. You know, that's a big qi tonic. It's even in the classics. It talks about a kind of qigong is doing enjoyable activities. I always, you have the 10 questions, right, in diagnosis. Nobody classically agreed which 10 questions to ask. So that made me feel free to change my 10 questions. So, I always included my 10 questions. Did you bring your checkbook? Do you have insurance? No. But I do ask in my 10 questions, what do you do for fun? How often does the patient shrug and go, fun? And they either think it's frivolous, or they're too busy, or too tired, or whatever, too much with the kids. They have no fun. Then you have to, well, if you had the time, if money wasn't such an overriding concern, what would you do for fun? And they name something. And then, you try to strategize in your mind, well, what could they do that's in that direction? I write it down on a little prescription pad. By the next treatment, I want you to have done this thing. That's your homework. That's your qi tonic. You have to do that. And if you don't, I'm treating with bigger needles the next time. That's what will be required, right? I'm motivating them to. You get the point of it, right? That we can work on tonifying qi, through our. Oh, okay, we can give them a lot of qi tonic herbs, but we can support that in their life. Another one is yin deficiency. We live in a very yin deficient culture because we have plenty of food and all that, but we don't have any regularity. Regularity cultivates yin. Also, feeling valued in our selected activities cultivates yin. Many people do not. They do a job they hate for a long time, then they retire, and you ask them, well, what are you doing since your retirement? I'm waiting to die. Okay, you have symptoms of yin deficiency. I'm going to give you Liu Hui Di Huang Wan. What a terrible choice that is. Liu Hui Di Huang Wan is not a strong yin tonic in general because it's a pediatric formula. Liu Hui Di Huang Wan was actually a modification of stronger yin tonic formulas to make it suitable for kids. I use it a lot in pediatrics. Kids don't have enough yin. They're growing into it. They're not full grown yet, reach full size. They need yin tonics. You get a hyperactive kid, often needs yin tonics. Needs more yin tonics because he has no regulated schedule. Doesn't eat at regular times, doesn't get up and go to bed at regular times like that. Maybe he comes from a home where the parents are totally busy and distracted, doesn't feel valuable, even hurts the yin more. But that old guy who comes in and says, since I'm retired, I'm waiting to die, it's going to be hard to tonify yin. So I can give him yin tonic herbs. But, you really want to tonify yin in somebody like that, you've got to give him animals, not plants. All of your animal herbs, much better at nurturing yin. Of course, it becomes the ethical issues around using animals as endangered species. And we're going to look at this as we get into spirituality in a minute. Even Sun Simiao, way back then, was worried about, Tang Dynasty, right? Was worried about the use of animals in formulas and being selective when you're going to choose. So this issue of environmental protection in herbalism is not new to us. Ancient China, there was thought about this. There was concern about the use and abuse of animals. But still, if you want to build yin in a person who doesn't have the life that supports yin, I recommend more animal substances because you're really borrowing right from the animal's nature, not just from this plant that has to be converted. Too dissimilar to us. So yin deficiency is a cause of hidden evils in the body. So we see it in kids and elderly people and the like. Another one is liver qi stagnation. When the liver qi, well, actually we should say liver qi stagnation. You see what happened right there? I had some difficulty spelling a simple word like liver and then the abbreviation for stagnation. I was like getting all messy. That actually is a kind of phenomena similar to dyslexia. What's happening is I'm trying to do two things at once. I'm trying to use verbal communication and I'm trying to do graphic representation by writing. This requires easy movement of qi across the brain. This is what's obstructed in kids with dyslexia too. And it's what's obstructed in kids who have real struggles in spelling. They usually have good verbal skills and can't spell to save their life. This means they can't move qi from one side of the brain to the other. What facilitates this? Yin and yang chao mai. So you have to use the yin and yang chao mai to help the body make that exchange. Mine is only a temporary issue because I'm lecturing and writing. It's not like something that happens normally in my life, so I don't need to treat it. But if it was more exaggerated, you would need to treat that. Treat the yin and yang chao mai. How do we treat the yin and yang chao mai apart from putting needles in bladder 62 and kidney 6? We have the person walk a lot. The heel striking the earth activates the yin and yang chao mai. It's why the word chao is a double entendre. It implies movement and heel. You see this struggle in translation a lot of times. Some people call it the yang and yin heel vessel. Some call it the yang and yin motility vessel. The character can go both ways. And I think Chinese medicine, they often like to choose things that way, where it kind of has an ambiguousness to the meaning. It shows a connection, right? So that's said to be an important longevity technique, is walking because of the heel striking the earth. So a lot of walking is a good thing. And then of course we can expand that to also doing kind of cross-body movement, where you're moving the leg on one side, the arm on the other. We talk about kids crawling, helping to develop this cross-body movement. But the yin and yang chao mai are your important meridians there. They actually go up, enter at bladder 1 at the corner of the eye, and penetrate into the brain, and in the process cross over. This is why they're important for helping move qi from one side to the other. And it's how Chinese medicine explained trauma on one side of the head produced a lack of mobility on the other side. Because the yin and yang chao mai, principally the yang chao mai, was blocked in that case. Because we always say lack of function is a decline of yang qi in that dysfunctional area. So, bang, then there's no yang qi reaching there through the yang chao mai. We have to reestablish that. So walking is good. Cross-body movements are important. And then, of course, we can directly treat those meridians to make that connection. Anyway, that little digression happened because I couldn't spell liver qi stagnation. I couldn't spell liver there for a minute. Liver qi stagnation, but may have liver blood deficiency. Both of these factors are important for protecting us from external evil. If the liver qi can't move or spread, evils get stuck in the body. If there's not enough liver blood, and this is a very overlooked diagnosis clinically, if there's not enough liver blood, the wei qi will collapse. So liver blood supports the wei qi out to the surface. This is why we often see women get much more vulnerable to external evils during menstruation, and especially during pregnancy. How about in pregnancy? You know what goes up a lot in pregnancy is the incidence of Bell's palsy, which is actually a lack of liver blood reaching the tendons and channels in the face. And then the evils penetrate in. So we need the liver blood to support that. So what makes liver blood in your life? Resting enough, sleeping at night, especially during liver time, because then the blood gets to be stored in the liver. People who are overtaxed and don't get enough rest, they typically end up with liver blood deficiencies. I said, we actually live in a blood and yin deficient culture, and sort of went off on that a little bit about how we don't have regularity and all of that. I have a friend who has the, he likes to say, it's a mistake to call Alzheimer's disease a disease of the elderly. It's actually a disease of youth. It doesn't show symptoms until you're old. And what is the disease of youth? Consuming your blood in yin. Therefore, you become vulnerable to this deficiency condition when you're old. But it's not caused, doesn't start then. It's our cultural nature to consume that kind of yin with our behaviors and societal attitudes and stuff that makes us vulnerable. I think that's a nice perspective. One more thing here. We have qi deficiency, yin deficiency, liver qi stagnation, with or without liver blood deficiency. And then finally, accumulation of phlegm and damp. This is sticky and makes evils stay in the body. So, and it's particularly true, and we have that saying, don't we? In youth, diseases that are hard to treat have phlegm and damp. In the aged, the diseases that are hard to treat have blood stagnation. So both of these obstructive factors make diseases hard to change. Well, in this discussion of external evils, phlegm and damp is the important one. It tends to make the evil stuck inside the body. So we always want to pay attention to that and resolve that phlegm and damp as part of this general treatment for clearing the lingering evils. Okay, shall we take a break for a few minutes? I gotta